Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Rousseau, and we have a great show that you'll want to stay tuned in for. We're talking about robotic surgery, and we'll get an expert view into the latest technology and life-saving procedures. We'll be joined by a panel of leading health professionals in this field, hearing patient stories of success and taking questions from our viewers. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at robotics with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have a fantastic panel of guests joining us. Meet Dr. Mahar El-Char, who serves as co-medical director of bariatric surgery at St. Luke's and was recently named one of the top bariatric surgeons in the United States. After a general internship at Drexel University Hahnemann Hospital, he completed his general surgery residency at St. Luke's and a fellowship in minimally invasive endoscopy and bariatric surgery at the University of North Carolina. Dr. El-Char is board certified by the American Board of Surgery and the author of Dr. E's Guide to Weight Loss, a guide for patients considering weight loss surgery.
It always makes me happy to see a successful patient after a bypass or a sleeve or any weight loss procedure, because I truly see the changes that happen afterward. St. Luke's University have a comprehensive weight loss center. We have developed an excellent reputation taking care of our patients because our outcome is better than other places. Back in the days, we used to do the procedures in an open fashion. And now things have changed and we're using robotic as the new approach for taking care of our patients. I believe that robotic surgery is the future. It's getting better and it's getting cheaper. We started doing that back in 2017 and now we're one of the busiest robotic centers in the country. You know, I've been doing this for a very long time. I've done thousands of operations, but I have to tell you, those stories always make me very passionate and very happy because, you know, doing the procedure is one thing, but seeing all the implications of a simple procedure like that on patients' life is truly amazing.
Welcome, Dr. El-Char.
Thank
you so much for being here.
Thank you for having me.
Tell us a little bit about the St. Luke's Weight Management Program, what it is and what makes it so unique.
So St. Luke's 10 years ago invested a huge amount of money in developing a comprehensive weight loss center. And that makes us a little bit different and unique compared to other places because we have a comprehensive approach to the issue of weight gain. So when a patient comes to us, we have a group of very well qualified and trained professionals to look at obesity as a chronic disease. So we have dietitians, social workers, surgeons, internists, whose job is to approach this as a team and take care of the underlying medical issues and help our patients lose weight in a healthy and safe manner.
It is such a wonderful program and so comprehensive in nature. We'll get a little bit more into how robotic surgery is used later in the show. Thanks for being here.
Thank you.
Joining our panel next is Dr. Dustin Manchester, a thoracic surgeon and associate professor of surgery at St. Luke's. Dr. Manchester earned his medical degree at Jefferson Medical College. He completed an internship at the Hospital of the University of Pennsylvania, a residency at Lankenau Hospital, and a fellowship at Allegheny General Hospital. Dr. Manchester specializes in robotic lung surgery and has a special interest in the surgical treatment of heartburn. In addition, through his robotic surgery fellowship, he's been able to train with leaders in robotic thoracic surgery around the country.
I've been here at St. Luke's for almost a year now, and the staff is just excellent. They are welcoming, they treat everyone, newcomers, patients, visitors like family. Thoracic surgeons take care of diseases of the chest. Predominantly, we see people with lung, esophageal, and central issues called the mediastinum. Robotic surgery is a tool that I use to help take care of patients in a minimally invasive fashion. It's a platform that allows us to operate in difficult to reach locations with very precise instruments and excellent visualization. I would say the thing I love most about my job is being able to interact with patients one-on-one. I would recommend St. Luke's because of that exact nature, that patients really are treated like one of our friends or our families. We treat them like we would treat our colleagues or their family. You know, people are given respect, they're given attention, and really they're given the top level of care that we can provide.
Welcome, Dr. Manchester. Thanks for being here.
Thanks.
Before we get started, tell us what is thoracic surgery and how robotics in this field can help.
Well, thoracic surgery is a specialty of surgery that deals with diseases of the lung, the esophagus, the stomach, and other disorders of the chest. As you can imagine, it's a pretty inaccessible and difficult location sometimes to operate in, and robotic surgery really allows us to access these difficult areas with precision and with great accuracy.
Excellent. So we'll talk a little bit more later in the show about the details of all those areas of the body you just mentioned and how you're treating them. Thanks for being here. Let's meet our final panelist, Dr. Daniel Vergis. Growing up in North Carolina under the guidance of his physician father, Dr. Vergis has always been passionate about medicine. He attended the University of North Carolina for his undergraduate and medical degrees. Dr. Vergis then completed his surgical internship and urology residency at SUNY Downstate Medical Center. He then went on to complete a fellowship in minimally invasive urological oncology at the Thomas Jefferson University Hospital in Philadelphia. His interests in urology include the treatment of urological cancers, kidney stone disease, and lower urinary tract symptoms. Outside of work, he enjoys cooking, home brewing, working in the yard, listening to music, and exercising.
Helping patients become cancer-free from prostate cancer, it's really why I do what I do. As a urologist, the patients that we see have problems with the kidneys, the ureters, the bladder. Facing treatment for any cancer is a daunting thing. Surgery for that, it's a big deal. One thing I really like about what we do here at the St. Luke's Center for Urology is that any patient that has a positive prostate biopsy for cancer, we schedule them at either the end of the morning or the end of the afternoon, so we don't have to worry about seeing another patient after that. I think having these longer meetings is important. It's important that they can formulate these ideas and just talk to you not only as a doctor but as a person and someone who has seen patients go through these treatments before. I like urology a lot. It's a nice mix of clinical medicine and surgery. The nice thing about surgery is you have a problem and you can fix it and get the patient doing better, and that's very rewarding. As a surgeon, that's what you always want, is a nice recovery. So if you have a nice operation in the operating room, that makes you feel nice, but really the proof in the pudding is when the patient comes back to see you and how have they recovered from the trauma of surgery. So when that goes well, it's a very nice thing to see.
Welcome, Dr. Vergis. Thanks for being here.
Thanks for having me.
What is the Center for Urology and what sort of illnesses are you treating there? When would a patient come see you?
The St. Luke's Center for Urology is a collection of our urologists here at St. Luke's, and urologists are special surgeons that work on the kidneys, the ureter, the bladder. People sort of jokingly call us the surgical plumbers of the human body.
I think it's a good term. Thank you all for giving us a better understanding of your individual fields. We're going to get into the show and start talking a little bit about what role robotics plays and the technology of robotic surgery at St. Luke's. So coming up, we're going to dig deeper into how the panel works together to solve complex medical issues and how robotic surgery can be performed in a variety of ways. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Being a mother and a wife, I was putting everyone else's needs above my own. I remember being overweight since kindergarten. My pregnancies were all fairly normal except for the fact that I was morbidly obese. So I did develop gestational diabetes with my first, and then because I got pregnant so quickly after, I just kept gaining weight after that. And then we had our third and then our fourth, and the diabetes got worse every time. I felt trapped in my own body and I didn't know how to get out. My primary care doctor referred me to the St. Luke's Weight Management Center. I had never had major surgery where I was completely put under for that long, but I knew that I was in good hands, and I knew I could trust Dr. Elchar. There's no way I could be where I am today without St. Luke's. It's amazing to know that for 34 years or whatever, that I was sort of hiding in my body. And now I can live the life that I knew that I always wanted but could never get to on my own.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for providing us with questions, which we'll get to later in the show. Joining me is an excellent panel of professionals in the medical field, Dr. Mahar Elchar, Dr. Dustin Manchester, and Dr. Daniel Vergis. Thank you so much. We've discussed the basics of their individual fields, and we're going to get into now a better understanding of the technology behind the various surgeries provided at St. Luke's. Before we do anything else, Dr. Elchar, what is robotic surgery and how does it differ from traditional open surgery?
Well, again, thank you for having us. A simple way to explain robotic is a new technology that provides us a new platform where the surgeon has better control of the operation. So the instruments are smaller. We get like 3D picture instead of 2D picture in standard laparoscopic cases. We have better control of the instruments. And in addition to that, we have more precise dissection, and because of that, the outcome is usually better and there's less pain for the patient.
And to clarify for patients out there that might be concerned, you're not just putting a robot on their body.
No,
the
we're
doctor
not.
is still
and
pretty
that's a very
involved.
good question. No, we're not. So it's not actually a robot doing the procedure. It's the surgeon doing the same procedure using a new technology. We call it a robotic platform, but we're actually driving the entire procedure.
Minimally invasive surgeries have grown so much in the last 10 or 15 years. How is that helping you serve your patients better and with recovery times?
Well, you know, whether a case is done robotically or minimally invasively with a camera and other small instruments, I think it truly benefits our patient and allowing them to get back to what they like to do faster. Their hospital stay is much shorter. Traditional hospital stays for larger operations were up to a week. Now with robotic surgery or minimally invasive surgery, it's down to 2 to 3 days. So I think they have a shorter hospital stay, less post-operative pain, and because of that, really their recovery is a lot easier for them to get through.
What an incredible advancement. And in that advancement, you have to have a lot of education along the way. And Dr. Manchester, I know that you work with the medical students at St. Luke's. Tell me a little bit about that program, how they're exposed to thoracic surgery, general surgery, and then robotics.
Well, at St. Luke's, we're proud to educate medical students and residents, and we, take great pride in kind of showing them what we can do and interesting them in our various surgical specialties. Robotic surgery in particular, I think, is something that is new, that our medical students are drawn to and our residents are drawn to because they see it as a emerging technology. You see it on the screen, you see the devices and how they can affect patients. And I think that is kind of building our next generation of hopefully doctors and surgeons out there to take this on.
That's excellent. Dr. Vergis, tell me a little bit about some of the procedures that you have seen better outcomes in your field because of robotic surgery.
I think one of the main areas where the robot really shines is in kidney surgery. So back in the day, if you had a small kidney tumor the size of a golf ball or less, your entire kidney would be removed. Now we're able to use the robotic technology to expose the kidney and to remove just the mass with a little rim of normal tissue and repair the remaining kidney. That decreases chronic kidney disease and decreases the chance that patients will end up on dialysis.
Building off of that for Dr. Manchester and Dr. Elchar, are there things that you've seen in your practices that you've been able to treat in recent years that maybe weren't treatable even just 5 years ago?
Sure. I mean, I can talk about my specialty. We're seeing a very high number of patients who had a weight loss procedure coming back with either a complication or weight gain over time. So we perform a very high number of cases that are called corrections or revisions, and St. Luke's is becoming one of the premier centers for those very highly complicated procedures. And we used to do those laparoscopically, and those procedures are 10 times more difficult compared to a simple weight loss procedure. And now with the use of the robot, those procedures are done faster, they're safer, and the outcome is much better.
It really is amazing technology, and this is such insightful information. We're not done yet. After the break, we're going to learn more about the advantages of having this technology available to patients. You're watching St. Luke's Health Now.
I'm a strong advocate of believing that St. Luke's did get my life back on track. I first came just to have my prostate reviewed. My symptoms at that particular point was my PSA level was getting a little bit higher than comfortable. Results from that biopsy was cancerous. We addressed that through the robotic surgery. I was not nervous. I didn't think it was going to be something that would take me out because that was based on my relationship with Dr. Burgess prior. I had felt absolutely no pain. Everything went well. Well, St. Luke's was, say, 200% better than most of the facilities that I've been at. They treat you as a person. They give you exactly what you need. So I just felt that that was a really good thing for me. The people are really nice. I mean, they take care of you. They just do things for you that would not be expected at a hospital. Thanks to St. Luke's, I am cancer-free.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have an interesting show tonight. We're talking about robotic surgery at St. Luke's. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Mahar Elchar, Dr. Dustin Manchester, and Dr. Daniel Vergis. Thank you all for being here.
Thank you for having us.
In the first part of the program, we talked about the basics of robotic surgery, how it affects each of your fields, and what cases robotic surgery might be used in, how minimally invasive techniques are beneficial to patients, and now we're going to discuss a little bit more about when robotic surgery is best. So Dr. Vergis, let me start with you. Robotic surgery is amazing, but not always the choice. How do you decide?
That's a great point that you're making. So it is preferred if we're going to take a gentleman's prostate out or try and save a kidney by removing a small mass, we would always like to do it robotically. That's not always the best choice though. If the patient has had many abdominal surgeries before, if they have certain issues with blood clotting or could not tolerate their abdomen being inflated with CO2 gas, which is necessary for robotic surgery, we would counsel that patient that they might need an open operation. If you look at the conversion rate that's quoted in the literature, it's about 1% or so, and if a patient has a higher rate than that, we do tell them that preoperatively.
I would imagine when patients come in, they want to find out really what will get the best results for what they need help with. And although they might be excited about minimally invasive or robotic surgery, sometimes that just isn't an option. Does that come into play for you, Dr. Manchester, in thoracic surgery?
It does, and what I would say is overall, the operation that's safest for the patient and that the surgeon is most comfortable with is probably going to be the best outcomes for them. If that happens to be minimally invasive or robotic, I think those both, are beneficial in that the incisions are smaller, the recovery is easier. I particularly try and offer robotic surgery for my more complex or larger operations because I think those are the patients that get the greatest benefit. For a small minor procedure that's only going to take about 30 minutes, I don't think those patients get as much benefit from a robotic operation, but would choose to probably do a minimally invasive one.
And Dr. Elchar, what are you weighing when you're making that decision? Dr. Manchester just spoke to the differences in the type of procedures. What are you considering in bariatric surgery?
Robotic can be used in any weight loss patient. However, the procedure that we pick for the patient depends on their BMI, depends on their expectations, the amount of weight they're trying to lose, the medical conditions. So it's not the approach per se, but it's the type of procedure because we have many weight loss procedures available to us.
And it is a very interesting distinction with the elective surgery versus something, say, Dr. Vergis, a patient comes to you with cancer. Talk to me a little bit about the types of procedures that you are able to do with a robot and the outcomes that you hear from patients after.
Indeed. So not only cancer operations, which are radical prostatectomy to remove a gentleman's prostate, kidney tumor surgery, also ureteral tumor surgery. The ureter is a small muscular tube that helps to drain the kidney, and previously you had to make a relatively large incision in the lower abdomen to do that type of surgery, and we're able to do that robotically now. The outcomes are nice in that the length of stay is quite low. Most prostatectomy patients are going home the next day, sometimes the day after the day after surgery, and similarly with our partial nephrectomy or partial removal of the kidney patients as well. So a quicker recovery, less blood loss as well, and getting back to their normal activities at a quicker rate.
You mentioned quick recovery times, and I would imagine that with that kind of diagnosis, you want to get back to your life and back to your other treatment as quickly as possible.
Absolutely.
Dr. Manchester, you do something very interesting. You do a procedure called LINX. Tell me a little bit about how that treats heartburn and how the robot helps.
Well, actually, Dr. Elchar and I are both two of the first surgeons in the St. Luke's network to offer this to our patients. So this is a specialized type of anti-reflux operation to prevent heartburn, or medically known as GERD, gastroesophageal reflux disease. This is a magnetic bracelet, actually, that we place at the junction between the esophagus and the stomach that helps to reinforce the patient's own natural sphincter that prevents reflux.
That is absolutely fascinating. And Dr. Elchar, you've been involved in this as well. What has the response been from your patients?
Yeah, so just like Dr. Manchester said, we have a comprehensive approach for heartburn. The reason I get involved in the heartburn field is because many of our weight loss patients, our bariatric patients, do come back with heartburn. So LINX is one of the options that we have. But we see many patients come to us with heartburn, and the advantage of the St. Luke's approach, which is a comprehensive weight loss approach, we have different options for those patients. So on a monthly basis, we get together thoracic, general surgeons, and bariatric surgeons, and we present those cases and we pick the best approach for the patient, whether it's LINX or endoscopic approach, or even a fundoplication or a hernia repair or something like that, in bariatric patients and also non-bariatric patients.
It's very comforting to see that the various specialties work together to communicate and do what's best for the patient. Dr. Vergis, how does that come into play in your practice, that team approach and the communication across the network for the patient outcomes?
I'm glad you asked that question. So every 2 weeks we actually get together with medical oncology, radiation oncology, pathology, and us as urologic surgeons, and every new diagnosis of cancer is reviewed, including the recommended therapies. And that's to make sure that we're following guidelines, that nothing's being missed, just to get more sets of eyes on those cases, and to determine is robotic surgery or open surgery or laparoscopic surgery the best approach for those patients.
The team approach is really important, but it's also important to make sure that the teaching, the training, and the technology is there, and St. Luke's has made that kind of investment. Why is that important to you as a physician, Dr. Manchester?
Well, ever since joining St. Luke's, it's a really community approach to providing the best care for our patients, whether that's the latest robotic device, whether that's, teaching our residents, our medical students. Overall, again, we're trying to offer the best care for our patients. Robotics is just a part of that, in which we, try and offer the latest and the best operation so that our patients really have the best outcome. So yes, it's a technology, yes, it's the new fancy product out there, but again, I think it's more than that. It's centered around what are our outcomes and how does this translate to our patients.
A piece in the important puzzle of patient care. So thank you all. This is such an engaging conversation. Up next, we're going to take questions from our studio audience. Stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to patients for sharing their stories with us, and to our amazing panel of specialists. We've had a good conversation about robotic surgery and St. Luke's unique approach. Now we're going to take some questions from our viewers. You guys ready?
Yeah.
Yep.
Sure.
All right,
Yeah.
so this is for all of you. Can you tell us the difference between laparoscopic, endoscopic, robotic, and minimally invasive surgeries? Those are a lot of terms we all hear out there. What are the differences? Who wants to take one of those definitions?
So I'll start with laparoscopic versus robotic. Anything that's not done open, if you don't make a large incision to do a procedure, that's called minimally invasive. And that can be endoscopic or laparoscopic. With laparoscopic, you're making very small incisions to do the same procedure in a minimally invasive fashion, meaning there's less pain, healing is faster, the chance of having an infection is much lower. And the main difference, to answer your question, between robotic and laparoscopic is that the incisions are even smaller. The pain is even less than laparoscopic. Visualization is better. Instruments are smarter. They're better. Dissection is easier, which translates into better outcome and less pain for the patient. So that's the new frontier. That's the future.
Excellent. Dr. Vergis, were you going to explain to us the endoscopic approach?
Sure thing. So scope, like in a telescope, is something you use to look at something. An endoscope that we use in urology would be one of two things: a cystoscope, which is a small camera placed into the bladder, or a ureteroscope, an even smaller camera that's placed in the ureter, the tube draining the kidney. The idea in endoscopy is you're placing a scopic instrument, a small camera, that you can pass instruments through to do an operation, whether it be destroy a tumor, biopsy it, or break up a stone and then remove that stone.
Dr. Vergis, how do surgeons and other staff stay up to date in the advancement of the latest technologies?
I think St. Luke's does a really good job with this. Every month or two we actually have a subcommittee meeting with OR leadership and nurses and the operating room staff to talk about how we're doing in our robotics program and to talk about the new findings in the literature to make sure that we're up to date.
Wonderful. Dr. Manchester, I have a question for you here. What other surgical procedures involve robotic surgery that were not mentioned here today?
So now, in addition to these specialties that we described today, there's multiple other fields that are using robotic surgery. Our gynecologists, oncologist surgeons are very busy and are very active using the robotic instruments to do a variety of procedures. In addition, there are St. Luke's physicians who do robotic cardiac surgery, heart surgery, as well as robotic ear, nose, and throat surgery. And finally, St. Luke's has been doing robotic general surgery for close to 15 years now.
That's pretty impressive. All right, last question, Dr. Elshar, for you. What do you do at St. Luke's to teach and train in your field?
So we're taking a different approach, like I said, when it comes to robotic and even laparoscopic cases. We are an academic center. We have a fellowship program. We teach other surgeons who are interested in weight loss. In addition to that, we have regular courses and seminars and lectures to teach other surgeons how to do those cases safely and efficiently. We're becoming a training center for other surgeons in addition to residents and medical students, and many surgeons from around the country as part of their training program is for them to watch other surgeons do those procedures, and that's what St. Luke's is working on doing now.
Well, on that note, Dr. Elshar, Dr. Manchester, and Dr. Vergis, thank you so much for being here. Thank you to our studio audience, and thank you to our patients and all of you out there for watching. For more information on robotic surgery at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.